Have you ever caught yourself thinking, I wake up at night to pee because I'm just getting older? Or if I drink less water, I won't need to go so often. These are some of the most common beliefs people have about frequent urination. But according to urologists, many of them are myths. The danger of myths is that they sound harmless, yet they cause people to ignore symptoms, delay seeking help, or try the wrong solutions. Frequent urination is one of the body's most important signals. It can point to bladder irritation, diabetes, prostate problems, or even kidney disease. And while sometimes the cause is minor, other times it requires timely treatment to prevent complications. In today's video, we'll bust the biggest myths about frequent urination, explain why they're misleading, and share the facts urologists want you to know to protect your health and peace of mind. When it comes to health, myths can feel comforting because they offer a simple explanation. But urologists warn that when it comes to frequent urination, myths are anything but harmless. They can delay diagnosis, create false confidence, and even worsen the very symptoms people are trying to manage. Take the myth that frequent urination is just part of getting older. While age does bring changes to the bladder and prostate, waking up multiple times a night or rushing to the bathroom every hour during the day is not something men or women should simply accept. Believing this myth often keeps people from seeing a doctor until the problem is advanced. Another myth is that if urination doesn't hurt, it's nothing serious. In reality, some of the most concerning causes like diabetes, prostate enlargement, or even prostate and bladder cancer may present with frequent urination but no pain at all. By waiting for pain as a signal, people risk missing the early window when treatment is easiest and most effective. Even lifestyle myths such as drinking less water will fix it can backfire. Dehydration irritates the bladder, concentrates urine, and can actually increase frequency. Worse, it stresses the kidneys and may trigger infections or stones. The real danger of myths is that they shift focus away from proper medical evaluation. Instead of getting a clear diagnosis, patients end up trying quick fixes, ignoring symptoms, or resigning themselves to poor quality of life. Urologists stress that correcting these misconceptions is the first step toward real relief and toward protecting long-term urinary and kidney health. When urologists meet patients struggling with frequent urination, they often hear the same misconceptions repeated again and again. These myths not only create confusion, but also stop people from getting the right help. Let's look at some of the most common myths and the facts that correct them. Myth 1 showed frequent urination is just part of aging. It's true that bladder and prostate changes are common with age, but waking up 3 or 4 times a night or feeling constant urgency is not something you should accept as normal. These can be signs of treatable conditions like benign prostatic hyperplasia, BPH, infections, or even early cancer. Myth 2, if it doesn't hurt, it's nothing serious. Many patients believe urinary issues only matter if there's pain or burning. But conditions like diabetes, kidney disease, and prostate enlargement can all cause frequent urination without any discomfort. Pain is not the only indicator of a problem. Myth 3, drinking less water will solve the problem. This is one of the most harmful myths. Cutting fluids too much concentrates the urine, irritating the bladder and making urgency worse. Dehydration also increases the risk of stones and infections. The key is balanced hydration, not avoidance. Myth 4, only women experience urinary problems. Because urinary tract infections are common in women, many men assume frequent urination doesn't apply to them. In fact, prostate-related conditions make urinary frequency one of the most common complaints for men over 50. Myth 5, it's all psychological. Stress and anxiety can make symptoms worse, but frequent urination often has a physical cause. Dismissing it as in your head delays the right evaluation and treatment. By breaking down these myths, urologists empower patients to see frequent urination not as an inevitable nuisance, but as a signal worth investigating, one that can lead to real answers and relief. From a urologist's perspective, frequent urination is never something to dismiss with myths or guesswork. It is a symptom, not a diagnosis, and the real challenge is uncovering what's behind it. That's why urologists approach every case like a detective, using a mix of patient history, physical exams, and targeted tests. When patients arrive convinced that it's just aging or I drink too much water, Urologists listen carefully but also probe deeper. They ask questions. How often are you urinating? Is it worse at night? Do you notice weak flow, urgency, or blood in the urine? These details help them separate lifestyle-related frequency from more serious medical conditions. Tests then bring clarity. A urine analysis can reveal infection, blood, or sugar. Blood tests check kidney function and diabetes. In men, a prostate exam and sometimes a PSA blood test help identify enlargement or cancer. Imaging, like an ultrasound or CT scan, may uncover stones, blockages, or structural issues. Urologists stress that without these steps, myths can blind patients to the truth. For example, someone who blames their frequent urination on too much water may actually have diabetes. Another who thinks it's just age could be missing early prostate cancer. By correcting misconceptions and replacing them with facts, urologists give patients not just answers, but peace of mind. Whether the solution is lifestyle changes, medication, or further treatment, the important thing is that the problem is real, diagnosable, and most importantly, treatable. So if myths lead us down the wrong path, what is the right approach to frequent urination? Urologists recommend a balance of awareness, healthy habits, and timely medical care. The first step is to track your symptoms. Pay attention to how often you urinate, when it happens most, and whether you notice other changes like weak flow, urgency, blood, or pain. A simple journal can give your doctor valuable information. Next, focus on hydration balance. Don't over-restrict fluids, but also avoid drinking large amounts late at night. Spacing your hydration throughout the day helps reduce nighttime trips without straining the kidneys. Lifestyle adjustments also matter. Cutting back on caffeine and alcohol, reducing salty foods, and maintaining a healthy weight all support urinary health. Regular exercise improves circulation and helps regulate blood sugar and blood pressure, two major factors in kidney and bladder function. Most importantly, consult a urologist if symptoms persist. A professional evaluation can distinguish between harmless bladder irritation and more serious conditions like prostate enlargement, diabetes, or chronic kidney disease. Early action not only prevents complications, but also gives you peace of mind. The right approach is not about guessing or believing myths. It's about taking your body's signals seriously and working with experts to find real answers. Frequent urination is one of the body's most common warning signals, and yet it's surrounded by myths that make people ignore or misunderstand it. Urologists want you to know that while aging, stress, or lifestyle habits may play a role, frequent urination is not something to brush aside or self-diagnose. It's a symptom that deserves attention, because behind it could be conditions like infections, diabetes, prostate enlargement, or even cancer. The good news is that with proper evaluation, the causes can be identified and effective treatments are available. Relief, better sleep, and peace of mind are all within reach, but only if you take action. So don't let myths guide your health decisions. Listen to your body, consult a urologist, and get the answers you need. If you found this video helpful, please like, share it with someone who might benefit, and subscribe for more trusted health insights.